So my name is Iram, I'm a GP, and what I would like out of here is for you guys to feel more empowered and more able to talk and more comfortable to talk about mental health when you go back to your. So what I'm going to do today, one of the things I want to do is do some myth busting. So that means there's lots of myths around mental health and what people are like and what the causes are, and I really want to kind of smash it into pieces. Okay? So that's one thing I want to get out of this. Then I'm going to talk a little bit about, can everyone can see okay and hear me okay, yeah? Okay. What Islam says about mental illness. Okay, so I'm not a scholar obviously, I just want to touch upon it briefly. Then I will talk about the types of mental health problems, the most common ones, and a little bit about them, so you understand, what the differences are. Okay. Then I'll talk about the causes, which is very important as well, because people have misconceptions about what causes mental health. So we'll talk a little bit about that. Then I'll touch upon the treatment. So someone wants to know about drugs. There you go. Yeah. Okay. So talk a little about the other treatments available, and a little bit about the drugs as well. Okay. Then one of the things I think is really important is number 6 is what can you do to help someone with a mental health illness. Okay. So we all probably know someone, whether at home, work, elsewhere, who has a mental health illness. We might not know that they do, and it's kind of, people find it very hard to talk to people with certain things, especially mental health, and that they don't know how to approach it. And I'd like you to be able to at least learn or start to think about how you do that. Okay. Then I'll talk a little bit about resources and where to turn for help and what's available out there. And then one of the last things is what can we do as a Muslim community. Now this is, as Tamsin was saying, is very important that we do have a stigma attached, and all communities do, and we do too. So what do we need to do that's specific to our community that we can all do, whether as individuals, so whether you go and talk to someone about it today, that's enough. You've talked about it, you spread the word, right? Or whether you go and do a charity raising event, or you get your local mosque to talk about it, whatever you get to talk about it, that's the point. What can you do, right? So I want you to think about that. And then if you see the feedback form, the first 3 points in the feedback form is kind of, so think about these things, because I want you to be able to understand more about mental health than you did before, okay? Feel more confident speaking about mental health to others, and view those with mental illness more positively than you did before. Okay, so that's the kind of what I want you to get out of it. Right, so first of all, we start with a quiz. So the first question is, how many people will experience some kind of mental health problem in the course of a year in the UK? So it's 1 in 4, 1 in 10, 1 in 20. How many people, just hands up, think it's 1 in 4? Alright, very good. 1 in 10? 1 in 20? Okay, fine, so you're pretty good at that. It is 1 in 4. Okay, so that's how common it is. So that's actually probably one of the most common things. Someone asks me at work, how often do I see people with mental health problems? Every day. Okay, at least more than once, at least. Okay, so that's that. The second one is, how many children in the UK have a mental health problem at any one time? Is it 1 in 10? Hands up. Okay, not bad. 1 in 25. Okay. And 1 in 5. Okay, so this is spread out a little bit more. The answer actually is 1 in 10. Okay, so it's a common myth that children, adolescents, teenagers, they're just growing up, they just go through these things. It's not really a mental health problem. And actually, 1 in 10 do suffer from mental health problems. So it's something to think about. That's quite common. That's 10%. So if you've got, like 10 nephews and nieces, one of them probably might be having a mental health problem. So something to think about. How many prisoners in the UK have a mental health disorder? Is it A, 5 in 10? Okay. B, 1 in 10? Okay. And C, 9 in 10? Actually, the answer is 9 in 10. Okay. Now, it's quite a good question.
Because the people who has mental health fighting or doing
well, this is about, yeah, okay, good debate. So, why do people think it's 9 in 10? So, do you think it's because
they're drinking, smoking, and then they have mental problem, fighting with women, with children, with outside, with people.
So they have mental health problems and then they commit crimes.
I think so.
The environment might contribute to that.
Yeah.
So being in an isolated environment away from what they used to.
Yeah. Alright. So, anything else? Anybody else want to say anything? Why they might think that it's 9 in 10? That's quite high, right? That's almost all of it. Okay, so it's almost a chicken and egg scenario. Okay, what came first? Did the mental health problem come, and then they committed crime? Did they commit crime, and then the mental health problem came when they were in the prison system, which is
Sometimes
not very nice.
poor people,
Yeah,
they don't have money,
that's right.
then fight
Yeah, so there's lots of
crime.
just because 9 in 10 have mental health problems, that means we're failing our mental health problem patients, mental illness patients, aren't we? Because a lot of them, you know, or the ones of people in hospitals, 9 in 10 have a mental health problem. So what's going on? I think you can read a lot into that. Stat isn't enough. You need more information as to why, what happened, you know, what other factors are involved, like poverty and stuff.
You said if maybe they develop the mental health problems in prison, so it's a
Maybe
prison system failing
might be.
prisoners
Yeah, so
and society as consequence.
Exactly. So I think whenever you look at stats, you should always question what they mean. And you know, it's not enough to have all 9%. Does that mean right? Everyone is going to have is a mental health problem is a criminal? No, it doesn't. Right. So it's kind of thinking about what the figures mean and what's behind them. The next is people with a mental health illness are more likely to be either a victim of violence. Hands up.
I think it's both.
Okay.
Yeah.
Okay. Well, the answer is in the clue is in the question, so it's either one or the other, it's not both. Right? So is it more likely to be, so there's about half of you, or to be violent themselves? Okay. Actually, they're more likely to be a victim of violence. Okay? People with mental health problems are vulnerable. Okay? You know, when I explain a bit about what mental health problems feel like, okay, then you'll understand how vulnerable they are. Okay? And anybody that's vulnerable is a victim, whether you're young, old, ill, disabled, mental health, deaf, you're not living the sun. You know, any vulnerability makes you a more a likely target. So actually, it's a myth that people with mental health problems are violent. They're not. They're more likely. So on the news, when you hear crazy killing, obviously they must have a problem with them. You know, you know, actually, there's more normal people or normal people who kill people. Okay. Right, next, how many people with mental health problems experience stigma and discrimination in the UK? This is not back home countries, this is here in the UK, here and now. Okay? So is it 70%? Okay, 80% and 90%. Okay, so kind of spread towards the end. It's actually 90%. Okay, so it's a high, it's really high. It's one of the most, this is, if you want to get me talking for a long time, ask me about stigma and mental health in our community, right? It's a big problem. There's lots of stigma and there's lots of discrimination we'll talk about later as well. Number 6, what percentage of homicides are committed by people who have been diagnosed with a mental health problem in the UK? Is it 5%? Oh, okay. 10%? Okay, 20%. Okay, actually it's 5%. Okay, so again, you know, myth busting. You know, only 5% of people killed, you know, are perpetrated by those who have mental illness. You know? Women are how many more times likely to be treated for a mental health problem compared to men in the UK? Twice as likely? 4 times as likely, 6 times as likely. It's actually twice as likely. Okay? Now, why do you think it might affect women more? Any opinions? Speak out.
Women find more discrimination in society.
Yeah, that's what. Okay. Good answer. Anything else? Do you think a man talks about his feelings to his GP? No. How often do men go to the doctors? Only if they're pushed by their wives, in my opinion, okay, or by whoever is around their family. Okay. So in society, in large, men are not allowed to be depressed or down or stressed. They're supposed to be strong and they're supposed to, you know, so men actually don't present with problems. So this figure doesn't cover all those people who don't present. Okay. So yes, I get it is twice as likely in terms of stats. So I said treated, remember, I didn't say how many people have mental health problems, but how many people are treated for mental health problems. Okay? So there's, I'm sure there's loads of kind of men out there who aren't treated. Okay? Number 8, depression affects how many older people live in the community in the UK? Is it 1 in 5? Right, 1 in 10? 1 in 20? Okay. It's actually 1 in 5, so it's really high. Okay? And then, did you know that if you're in an old people's home, then it's 2 in 5. Okay? So people who are kept in homes are twice as likely to suffer from a mental illness. Okay? Older people. Okay? How many more times likely are young Asian women more likely to commit suicide compared to young white women in the UK again? So is this twice as likely? Okay. 3 times as likely? Okay. And 5 times as likely? Okay. So the answer actually is 3 times as likely. Okay. Now this is a problem, for Asian community. That why do Asian women are more likely than white women to commit suicide? Okay. So there's a whole lot of thing about the problems of the discrimination they face, that gain access to care, whether the services are culturally sensitive, they can speak the language, and then actually studies show that Pakistani women the study was on, that they don't either go to the doctor, right, number 1. If they do go to the doctor, they don't get the right treatment because they can't really speak up for themselves, okay, right? And then if they do get the right treatment, they don't recover as well, okay? So that's to do with what other support they have. So there's like a triple kind of whammy there, isn't there, really? So they're disadvantaged in so many ways. And the last one is, what's the leading cause of death in men under 35 in the UK? Is it A, heart disease, B, cancer, C, suicides? Yeah, right, okay. So that was, I suppose, an easy question, but again, that's a big problem then. So the leading cause of death is suicide in men. And that actually underlines that they don't present to services. Okay, they just go, they wait and wait until it gets so bad, and then that's what they do. Okay. Right, so let's get back to our talk. Okay, so just a little bit of overview in terms of timing. So we've done up to the quiz bit, and now I'm going to talk about the causes and types of mental illness, and then I'm going to give you some group work, just a quick 10-minute discussion about the impact, which will give you a bit of a break, and then we have a break, and then we talk about treatment and what you can do yourself to help someone, and we talk a little bit about the journey as well. And then we'll have another little group work session, and then Q&A at the end. And then, this time is kind of variable. If you really like talking about one of the things, because as I said, I want to ask questions if you want, then we can cut things down, speed things up. It's up to you. We'll see how we go for time. Okay, so a little bit about mental health. What is mental health? Okay, so mental health or being mentally healthy isn't just not having a mental illness. Okay. It's more than that. So just like being physically healthy isn't not just having an illness, it's actually about being physically fit, okay? Exercise and stuff like that. The same with mental health. If you've got good mental health, you can make the most of your potential. For example, at work, at school, you're living a full life, okay? You can cope with life. Okay, let's get rid of that. Okay, you can cope with life and its trials and tribulations, which are a normal part of life, okay? You can play a full part in your family, workplace, community, and among friends. Okay, so it's about living a full life. So so well-being, or other words for it are emotional health or well-being. It's more than just not having a mental health problem. Okay, and then just to say that we're all different. So we all have times when we feel down or stressed or frightened, and most of the time these feelings pass. Okay, everyone is different though. You may not bounce back from a setback, while someone else may feel weighed down by it for a long time, okay? So it's just remembering that we're all different heights, shapes, sizes, hair colours, and just inside our brain is different as well, okay? So it's not, it's like any other illness, really. So I'm going to talk a little bit about mental illness and Islam. Okay, so as Muslims, we believe that all diseases are a trial and test from Allah. Okay, and that the test of having an illness makes our sins are forgiven for it. Okay, that's what is in the Quran. Okay. Then there's a hadith that says that there is no disease that Allah has created except that He also has created its remedy. Okay, and that's similar. Another hadith down below which says, "Oh Allah's Messenger, should we seek medical treatment for our illnesses?" He replied, "Yes, we should seek medical treatment because Allah the Exalted has let no disease exist without providing for its cure, except for one element, namely old age." Okay? So the point being is, diseases, tests, trials, tribulations, hardship, these are part of life. Okay? We all know that, but when it comes to mental health, we seem to kind of forget it. Okay? So the important thing is that we are supposed to seek treatment. Okay? Then there's an interesting paper that I came across, which is by a lady called Amra Haq, and she looked at psychology in Islamic history. So two people, and so this is a paper. I mean, this presentation I can send to Tamsila, and she can, you can put it on your website or something. And people can download it. As I was saying, there's an interesting paper by Mahat who talks about psychology from an Islamic perspective and contributions of early Muslim scholars. Okay, and I just picked out two people from that paper, but there was several at least. Okay, so one from the 9th century, Abu Zayd al-Balkhi, and he described several types of mental illness that we recognise today. And he actually criticised medical doctors at that time for ignoring the psychological aspect of disease. And he actually advocated psychotherapy, so that's talking treatments, which I'll talk about later. Okay? So, if you think about it, this has been a problem for a long time that, Muslims in the past have understood and recognised and treated. Okay? Then everyone knows Ibn Sina, right? And he also talked about mental health problems. There's lots of other scholars, but I just picked these two out as the ones that I found most interesting. But as I was saying about this presentation, I'll email it to Tansila. She can put it on the website so you can get this information, from there. Right. So I talked at the beginning about I want to bust some myths or smash them to pieces. Right. Now this is the first one. Right. If you don't remember anything from my talk, you need to remember this one. Okay. So the myth is it's not a real disease. There you go. Mental illness is caused by a weakness rather than a medical disorder. Psychiatric disorders are not true medical illnesses like heart disease and diabetes. People who have mental illnesses are just crazy, right? There's lots of words, crazy, psycho, there's loads of words that are quite demeaning that people use, newspapers use, to describe, people who have mental health problems, okay? So, what I want you to remember, that it is a medical condition. It disrupts the person's thinking, feeling, mood, and ability to relate to others and their daily functioning. Okay? Research shows that there are genetic factors, biological factors for these problems, and that they can be treated. Okay? So the way I explain it to my patients, right, because that's just a paragraph, right, is I say, okay, diabetes, okay, that is a lack of insulin. Okay, so you haven't got enough insulin, so you can't control your blood sugar, so you get diabetic. Okay? Now, you can have lots of reasons for why you're lacking insulin. It could be because someone took your pancreas out. It could be because, there's lots of reasons why you're not producing insulin. So with mental health problems, it's to do with imbalance of neurochemicals in the brain. Okay, so chemicals in the brain, they help one brain cell talk to the other brain cell. And people with mental health problems have an imbalance. So you have too much, too little. Okay, and that's that imbalance that causes them to feel this way. And that's why we have medicines, because the medicines that we give, they increase some things, they decrease other things, and that's how they work. So if it wasn't a real medical illness, then why is that there, and why do we have tablets that alter that? Okay, so it must be. It's not. So would you tell a diabetic, don't take your diabetic medicine, you'll be fine, it's just in your head? No, you wouldn't. So why do you tell someone who's got a mental health problem just to cheer up, be positive, you'll be fine? You know, it's a mental illness. It's an illness. It's not just in the head. So that's one thing that you better remember. Okay, right. So causes of mental illness. So there is a link with family history. Okay, so if you have a family member who's got a mental health problem, you're slightly more at risk, but it's only a small risk. Okay, so there's a background risk, say you're having a problem anyways, 1 in 100, and if you've got a mental health, all the rates vary for the different conditions, but I'm just giving you an example. Okay, so if it's 1 in 100 anyway, a chance of getting a problem, then if you've got a family member, it might be 2 in 100. It's not like now it's 14 in 100. It's not like it's, it's only a small increase. So again, and most people who do have mental health problems don't have anyone in the family affected. So again, it's a myth, that it's to do with just your family history and genetics. But there is a link there. So this again, when there's lots of different things going on, then you start thinking actually it's more complicated than you first thought. So there's a genetic bit, there's another bit. Okay. So things that lead to mental illness are stresses. So when I talk about stresses, I talk about things that stress us out. So normal life events that happen, as in they happen in life all the time, but they cause stress. Okay, so we've categorized into the past and the present. So in the past, it could be, a difficult family background for whatever reason. This is just a few things that I've written down about abuse, but there's lots of forms of abuse, as we know. There's neglect, there's emotional abuse. Okay, just constantly berating someone. There's sexual abuse. There's domestic violence. There's emotional abuse. I've said that already. Physical abuse, financial abuse, torture, and so having a difficult kind of life as a child will mean that you're more likely, okay, not 100%, but more likely to have a mental health problem. And the next one is a present stressor. Okay, so a stressful life event. So things such as, I think there's 5 things that are seen as stressful life events. Getting married, believe it or not. Moving house, new job, bereavement. I can never remember the last one. But, basically there's so these are things that happen that stress us out. So if you're moving house, if you're getting married, if there's a bereavement, if there's relationship difficulties, financially in this kind of austerity time, there's problems, right? Then these are all stressful life events. Okay, but like I said at the beginning, some of us can cope with them and some of us can't, and that's due to the difference in chemicals in the brain. Okay, and then physical illness is another reason. So people who have head injuries or epilepsy, they're disorders of the brain, they're more likely to have mental health problems, which again leads to my proof that this is an illness. Because why would brain damage from an accident cause mental health problems? Because once that's damaged, right, for whether it's a physical damage or whether it's a neurochemicals imbalance, it's going to cause, it can cause a mental health problem. Should we just open that window now? It's getting a bit hot. Is it just me? It's just the. Thank you. And the last thing is long-term substance abuse. So again, some people, they can get away with doing drugs, okay, and illicit substances, and they're fine. But some people, because of their brain chemistry, will react badly, okay? But it's not just, I'm not talking short-term, I'm talking long-term, okay? There is a link, okay? It's very disputed, so some people say, well, you've got the kind of susceptibility anyway, and then it just triggers it, okay? So there's a lot of kind of debate about whether it causes it, okay? But it certainly doesn't help, okay? And, okay, this is my second myth actually. So this is that addiction is your own fault, okay? So the myth is that addiction is a lifestyle choice and shows a lack of willpower. People with substance abuse problems are morally weak or bad. So that is wrong, because the fact is that addiction is a disease that generally results from changes in brain chemistry, so similar to the stuff I talked about with mental illness, okay? And it has nothing to do with being a bad person. Now, if any of you have met an addict, no one would choose to live that life, whether that's alcohol, whether that's heroin, whether that's any of the drugs, okay? Different reasons people turn to drugs, okay? It might be sometimes an escape, sometimes it's just for pleasure, okay? But once they're addicted, their whole life revolves around drugs, okay? So where do they get their next hit from? They steal from their families. They take money that's for food for their children to spend on drugs. Okay, they lose their job, they lose their family, they live in squalor, they prostitute themselves. So being an addict isn't enjoyable, isn't a lifestyle choice. No matter how you fell into it, maybe you were getting abused and the only way to get out, to escape from your bad life was to take something that got you high, to give you 5 minutes of rest, okay? And then you got an addiction problem, okay? So again, you know, this myth that addiction is the problem of the people who are addicts, no it's not. You know, it's an illness and there's lots of reasons why they may have ended up there. So we need to break down these prejudices that we all hold, okay? Or society holds, for sure. Okay, so now, is that okay everyone? Okay for now? I'm not getting bored, not falling asleep. Good. Right, so now I'm going to talk a little bit about the types of mental illness. So there's 6 up there, and I'm only going to have 1 slide in each. I don't want to give you a whole lecture on how you diagnose someone, what treatment you give. I just want you to understand, okay, what it is and what's the difference between one and the other, okay, and how that, you know, maybe a little bit about how that person would feel, that a person who has that problem, okay. Right. So the first thing I'll talk about is most common. Depression and anxiety actually are together are the most common mental illnesses, okay, that people have. And what depression does is it lowers your mood to the point, not just when you're having a bad day, but it makes you feel hopeless, worthless, unmotivated, exhausted, okay. It can also have physical symptoms such as affecting your sleep. You either sleep too much because you're so tired, or you can't sleep and you're awake all night, okay, or keep waking up at night. It affects your appetite. Some people overeat, some people don't eat, okay. There's no hard and fast rules. It affects your libido. It affects your self-esteem, okay, and it makes you tearful. So people often cry with depression. Not always. Now, with depression, it's categorized as mild, moderate, or severe. So someone who's mild will have these symptoms. Now, actually, before I go into that, a lot of you might be thinking, you know what, I feel like that sometimes. And that's actually true, yeah? I felt, not worthless maybe, but hopeless sometimes, you know, okay? And I think what you've got to remember, like a lot of things, is spectrum, okay? So you have, it's okay to feel a little bit, that's actually what society calls normal, okay? And then it gets to middle, and then it gets to this, it's along the spectrum. So everyone is on the spectrum somewhere, okay? At some point in their life. Now, so when it's mild, you might have these kind of symptoms that are happening. So if it happens in 1 or 2 days, that's not a problem. If it happens for more than 2 or 3 weeks, that's when it becomes a problem, okay? And a mild person might feel pretty crap, but can get up and go to work and just about keep it together with their family and put her in front and put her face and pretend to smile, you know? But it's a real struggle, it's really hard, okay? Because if you're feeling like those things that I said, hopeless, worthless, you know, you're not sleeping, you're going to feel pretty unwell, okay? Then a moderately affected person with moderate depression will maybe they will be able to keep things together. So we call it functioning. So, you know, what you need to function to go shopping, get some food, clean, go to work. These are what you need to function. So they can do it some days, but they can't do it other days. Okay, so some days you just have to call in sick, it's all too much. Okay, and then severe people have usually they're to the point where they can't get out of the house. Okay, they can't get out of bed. You know, they might have suicidal thoughts. Okay, and even with suicidal thoughts, there's a spectrum. So you can just think of them, but never do it. Just fleeting thoughts. Okay, Or there might be where you actually tried something in the past, but it's an overdose, cutting your wrist, some people have tried hanging, all those things, up to where you actually, committed suicide. Okay. Now, when I ask patients, why do you cut yourself, right? And they say because I'm in so much emotional pain that the only way to kind of get rid of that emotional pain is to give myself physical pain so that it makes me forget about my emotional pain. So how must you feel? How bad must you feel to cut yourself? Because that makes you feel better because you're in so much pain. Okay? So, again, so these are, and so you just imagine if that's how you felt all the time, okay, that can't be easy. Okay? Anyone ask anything about that? Or maybe with the self-harm side of things or anything? Now, like I said at the beginning, I want you to ask things as you go along. It's a safe environment. You can ask questions here, and it's okay to do that because I really want you to be able to, learn. Not feel shy or feel embarrassed. Nothing that ask me now. It's better than offending someone later, right?
So you see, people who have different types of depression.
Yeah.
Do they oscillate between the types?
Yeah, they can. Yeah, absolutely. Yeah. So when they have good days, or even good days or good months, or when things are less stressful, they might get less, and then they can get bad as well. Yeah, you're right. Okay, so the next very, very common mental health disorder is anxiety. Okay, so this is when people have a constant, unrealistic worry about any aspect of their life. Okay, so they might feel fearful of, constantly worrying about money or about their job, about what other people think, or they might have a phobia of going out in public or being in private trains or private places. Okay. But it's a constant and it's unrealistic, as in it's not actually happened or going to happen, but they're unrealistically. So again, you're constantly worrying. That's taking up a lot of your kind of headspace. Okay? Then they come with other symptoms. Are they restless? They might be fidgety and kind of they have sleeping problems. Normally with anxiety, you can't sleep because you're constantly thinking. Your mind just going and going and going. Right? You can't switch off. Right? You might have increased heartbeat, so feel your heart pounding. You might get stomach upset, so like when you go for an interview or you get butterflies, you might have, like some people have diarrhea as well, but that kind of adrenaline rush, that's what anxiety is like. You're constantly have adrenaline rushing through your body, right? And that's exhausting, right? Okay. And then they might feel shaky, okay, and they might have muscular tension because when you're stressed, everything tenses up, and then the common thing they get is headaches or pains. So a lot of kind of I find a lot of my older Asian or I suppose Muslim patients who don't tell me they feel hopeless because I don't know the word for it or Punjabi word in the end of the day, right? But they do feel pain everywhere, right? So they've got pain, and it's because they're always So I always ask people with random pain that I can't fit into anything because it's not a real. So where's it coming from? Why have they got pain all the time? Okay, and it's actually, and then when I delve into it, it's because when you ask about their history and family life and what went on, you realise actually they're either anxious or depressed. So pain, kind of all over body pain or pain here or pain, that you can't work out, doesn't have another medical explanation. It's always worth checking. So in fact, you were talking about your pain, right? Yeah. So again, so pain where you can't treat it, might be from psychological pain. And then panic attacks. Some of you may have seen or may have had or may have known someone who has them. These are when these feelings, this adrenaline gets so overwhelming that they might hyperventilate. Okay, they might sweat. They kind of can't take it anymore, and then those are, and again these panic attacks can happen anywhere, anytime. Sometimes a lot of my patients, I don't know why, it just happens. But then sometimes they haven't been able to work out why or what's going on in their life, why they're feeling stressed, and so you might be stressed about something else, but it comes out in this way. It doesn't happen only when you're in that stressful situation. It can happen afterwards. Say in the middle of the night when you should be switching off, it can happen. Okay? And then phobias, I've talked about phobias of going out, of small spaces, of any phobia, any fear of anything. Any questions, comments yet?
With depression and anxiety, do these things go hand in hand?
They do actually, yeah. Yeah. So depression and anxiety often go hand in hand. Yeah. Not always. You can have one or the other, but they do come together. So they're of all the mental illnesses, they're the ones that come quite close together, and they're most common as well actually. And one can lead to the other.
On sleeping, sleeping excessively, is that?
Sleeping, usually with anxiety, usually it's not being able to sleep because you're constantly worrying, so you're on like overdrive, hyperdrive, so you can't sleep. Okay, but probably when you're exhausted after 5 days of not sleeping, you probably will sleep. Fair enough, right? So not sleeping, so sleeping too much is usually a bit more depressed. I mean, to be honest, sleeping problems can happen in any mental illness, you know. So these are common kind of signs. You know. So this is schizophrenia. So this is probably one of the most commonly misconstrued, really, condition, right? So, you know, when people talk about schizophrenia, they think of schizo, they think of someone with two heads, split personality. You know, these are all the kind of, you know, degrading and incorrect terms that people use to describe people who have schizophrenia, okay? So what is schizophrenia? Schizophrenia is when people hear voices or see things, which are called hallucinations, that other people can't see, okay, or can't hear. Or they have a belief, okay, or a delusion that other people don't share, okay? So that is abnormal for your context. So what that means, abnormal for your context. So if you're a Muslim and you believe in jinn, so talking about jinn isn't actually out of your context. Yeah. So say an English or white person seeing you and you talk about jinn, you shouldn't think, oh my God, you must have a delusion. Maybe not. Maybe you do, but maybe not, because that's part of what's normal for your context. So every culture, even within cultures, you have microculture, right? You know, like, and you take any country, there's about, I don't know how many cultures in that country, okay? So you kind of, you know, this is why you need to understand a bit about the person, what's normal for them and what's abnormal, okay? So then these voices actually I'll come back to that. So these voices that they hear, there can be one voice, there can be two, there can be 20, okay? And they're constantly talking to them, okay? And they can, sometimes they're friendly voices, okay? But sometimes they're nasty voices. And usually when you get an illness, when you're ill with it, they're critical voices, okay? Or they tell you to do things like kill someone, kill yourself, you're worthless, you're bad, right? Okay? So this, you know, so again, imagine having that voice in your head all the time, okay, or a lot of the time. You know, you're constantly getting bombarded or whatever with these kind of voices. Right? Now, this leads to like a confusion about your thoughts, because some people who don't recognise that they're ill yet, they think these voices are real, so they might think that the government has put something in their head, and that's where the voices are coming from. Okay. And the other thing they think is that their thoughts can be read by other people, okay? Or people are putting thoughts in or taking thoughts out. Sometimes they think the TV is talking to them, you know, and it's just conspiracy theory type things, okay? So again, because your confusion and your perception of reality is kind of, you know, you don't know what's real and what's a voice and what's an illness, and, you know, and it gets really, really, you know, because you don't know, and you're really worried, you're tense, you think the government's after you or whatever, okay? Which it probably is in this country, but hey. Okay, and then because of this kind of confusion, you're withdrawn because you want to keep separate. You don't want to, you don't trust anyone. Just trust is the issue, and you're suspicious of others. And then they're reluctant to believe that they need help, okay? Because again, perception of reality is distorted, so they don't understand that they actually, need help. And then what's interesting actually is up to 4%, depending on which study you look at, up to 4% of the population hear voices, okay? And most of them have no problem. So hearing voices isn't abnormal. A lot of famous composers, famous people, geniuses hear voices, okay? And some people say they're inspirational, they have them crack a theory, they have them write a wonderful piece of music. So hearing voices isn't actually, again, spectrum of disease. Some people hear them, they're fine, some people hear them and they end up in the hospital, okay? So there's a spectrum again, and that's another thing actually it's important to remember about things having spectrums. So, famous people who hear voices. Anybody know anyone? I had to look this up actually, so I'll let you off if you didn't know anymore. But I picked some ones that might be relevant. Right? So So Mahatma Gandhi, he had voices. Winston Churchill, okay. Sigmund Freud, probably explains a lot. John Forbes Nash, Nobel Prize winner, the guy, Beautiful Mind, the Russell Crowe film, he had voices.
George W. Bush, you hear the word of God telling him to go.
Yeah, you did. Yeah, actually, yeah. A lot of, see, I don't know if I'm believing, but yeah. But yeah, apparently he did, right? And then who else was there? Carl Jones, another psychiatrist. Anthony Hopkins, that's the other actor. Okay, so a lot of these, so we don't hear about them because it's taboo and we don't talk about them. So hearing voices isn't a problem. It's only if it gets to the point where you get ill. That's a problem. Right? That's an interesting fact actually that I didn't really know. As a medical student, I wasn't taught that. And that's not common knowledge. And it's only when I, had to look into it because of and then I realised actually, I didn't know people hear voices. Okay. That's a bit of fact you can tell people I think that's, and no one else knows that. Okay. So the next thing I want to talk about is sorry, I forgot to ask. Anybody want to ask me anything about schizophrenia? Because that's probably you might have questions about that one. I mean, you can ask me in the break as well, but
This is a class issue, like you've just been talking about. The famous people who have voices. They can get away with it and it's fine and respected.
Yeah.
If you're kind of working class, you're poorer, and you say you hear voices, you're stigmatized more.
Absolutely, yeah. No, absolutely. So famous people will be like, oh, wow. But if I said I had voices, you'd probably go, oh, okay. You know what I mean? So that's the case. And in fact, in this country especially, black people are stigmatized about voices. They do have a higher level of voices, and and they're seen, and there's more of them in prisons, disproportionately in mental health institutions. So in this country, the group who are most affected by that is the black community. Any other comments, questions? No. So the next I'll talk about is OCD, which is Obsessive Compulsive Disorder. So these now, the next three are, I suppose, less common. So with Obsessive Compulsive Disorder, you have two things, obsessions and compulsions. So obsessions are repeated, unwelcome thoughts and ideas or urges. So these might be like about, everyone knows about hand washing, how they think it's germs and they need to do things like, 7 times. Worrying that you haven't locked the doors, switch the oven off, switch the light off, that sort of thing. Also, people have urges or thoughts about kind of committing crime or sexual abuse or things. That's actually quite common. People have those thoughts all the time. I didn't know that again. That because there was one patient who had thoughts about abusing children, and we all went, and actually the psychologist said it's really common. It's one of the most common thoughts people have when they have, obsessive thoughts, which I didn't know. So the other thing is compulsion. So these are repetitive activities that you feel you have to do a set number of times. So like I've said, hand washing, locking the door 3 times, checking it. I mean, to be honest, like some of these things I often say, like I'm obsessive, okay? I'm, at work, if I make a mistake, someone could die, someone could sue me, someone could be harmed, So I check things a couple of times, and I know I do, okay? So again, spectrum of disease, a little bit of obsession and compulsion and checking things, not a problem, you're just being thorough, in my mind, okay? But if it gets to a point where it's kind of taking up all your energy, all your time, all your thoughts, then it's affecting your ability to function, so again, functioning, your ability to function, then it's a problem, okay? So again, we see that, that thing about spectrum of disease, it depends where you are. A little bit of it's not a problem, it's normal, but when it gets to the point where it affects you daily, you can't function, that's when it's a problem. So these obsessions, they interrupt your thoughts and concentration on work, make you feel anxious. So if you're always worried about you haven't locked the door, you haven't done this, you haven't done that, how can you concentrate on anything else? How can you do your work? How can you write that email? How can you, you can't do complex thought processes if you're constantly worrying about something, okay? And then if your time is taken up to wash your hand or lock the door or whatever, you're wasting time. And also the relief that you get short-lived. It doesn't actually make it go away. It just reinforces it in a way. So that's why when you treat people with OCD, you try and break those habits, slowly, because otherwise they'll get really anxious about it. Okay. Anybody want to make a comment, question, anything about OCD?
Is OCD the treatment for more to do with like medication, or is it actually more to do with making
So, see, with treatment, which I'll talk about later, I would say talking therapy is a mainstay and the kind of foundation of any treatment of mental illness, okay? And it's harder to find and get and resource because it involves people's time, okay? While medicine is easy to give, you write a prescription, 2 seconds and the patient's gone, right? But so I would say talking therapy is a mainstay, okay? And then tablets do help, and I'll talk about when they help, okay? But for OCD, the main thing is breaking down these thoughts, okay? And there's something called CBT, which I'll talk about, which is about kind of challenging these thoughts, okay? So if you think you have to wash your hands so many times, well, wash them a little bit less, see what happens. Nothing happens, right? You've learned, if you wash your hands less, nothing happens, and therefore, hopefully your brain will start to kind of accept that. It'll be really anxious when you do it, because you'll think, I'm going to die. Because if you think, well, what will happen if you don't wash your hands? I'll get a disease, I'll get an infection, then what will happen? Then I'll die, okay? So that's how they think, that's how far their thinking goes. So if you tell them not to do it, that period that they're not doing it, they're going to get really anxious, so you have to kind of support them through it. But then they learn that actually it doesn't cause anything. But it's easier said than done, obviously. It's not a one session, just don't wash your hands and fine, It's a bit more kind of...
And does it usually get worse when people are stressed about other
That's right,
things?
yeah. So this is how I was talking about the causes, and you've got background factors, or things that happened in life before, and things that are happening now, right? So things that precipitate stress. So moving house, work's getting stressful, you've got a deadline on, financial worries. So when you're stressed, all these things, they get worse. Right? Great, thank you. Any other? No? Right, so the next I'm going to talk about is eating disorders. So there's 2 types of eating disorders, anorexia and bulimia. Okay. Actually, bulimia is more common, but we probably have all heard of anorexia more, or think it's more common maybe. And in anorexia, people don't eat enough, and they therefore lose weight. In bulimia, they might binge. They might then make themselves vomit. They might not. They might just binge. Okay. And then they might take laxatives to get rid of the food, excess food that they think that they're eating, okay? And their weight is usually steady, actually, okay? But so why do people have this compulsion around food? It's like, going back to OCD, it's a compulsion, isn't it? Or it's and when you talk to people with anorexia, they often say they feel they have no control over any other aspect of their life, okay? So they can't control the violence that's happening, things that happened in the past, their situation now, okay? The one thing they can control is food. So they obsess, they get fixated, they block everything else out, right? They pretend it's not there and they get fixated on just food. Not eating too much, worrying about their weight, am I fat, am I thin, okay? And that's all they fix. So they get obsessed about that to shut everything else out, because that's the only way they feel control. Now again, let me ask you, not eating, making yourself so thin that you're fainting, that you can't do a day's work, that you can't function, is that an enjoyable way to be? No, right? That is, again, a horrible place to be in, where that's how bad it is. That the only way you can feel a sense of control in your life is by starving yourself, okay? So they, like I said, they constantly think about food. Everything is fixated on food, on their weight. Even if they're really thin, you can see their bones, they think they're fat. Okay, right? And so there's a deception or distortion of perception of self-image, about body, about how they look, if they're pretty, if they're ugly. Even if they might be fine, but they have this kind of distorted self-image. Okay, and actually, so when you dig deeper about these problems, it's to do with things that have happened before, deeper issues, emotional pain, right? So again, it's just something they fixate on to try and get through it, because they can control it. Okay? And this disorder affects 1 in 20 women, and hardly, I can't remember the figures for men, but much less men. Okay? So again, I'll talk about the difference between men and women. It might be that in a society where we are focused on women's bodies, okay, to veil, not to wear niqab, not to niqab, to be skimpy, not to be skimpy, to have perfect skin, not to have perfect skin, okay? You know, all these, everything about, you know, women's bodies, it's kind of not surprising that that's where one of the big things that women take out there tend to fixate on, okay? When they have these, you know, sorts of issues, okay? And then men, you know, they do have the problem, it's not like it's not there, but it's less, or maybe men don't come forward, maybe they don't talk about it, maybe, you know, they just end up committing suicide, like we said at the beginning, right?
Can I ask a question?
Yeah.
I don't know if you're going to go on to talk about this, but you know you were saying about control and food.
Yeah.
Does this also relate to working out, as in exercising? And is that, how do men fit into that? And also, is it called something different?
Actually, when it's all about to do with kind of self-image, okay, and fixating about weight, okay, and then the food, you know, so you might have the self-image and weight without food, okay, but even people who work out a lot, they're really careful about what they eat, okay, they will only eat certain things, okay, you know, so it actually food does come into it in that way, and maybe, but then see, with exercise it's a difficult one, because exercise, everything in moderation is fine, okay, so exercise in moderation is great for you, it's good for you, it keeps you healthy. But if you're obsessed about it to the point, so when you're talking about any medical problems, if it's to the point where it impacts on your daily functioning, okay, so being able to get up, keep a job down, keep a family down, you know, be able to cope with life, if it affects your functioning that you're choosing to go to the gym rather than visit someone in hospital, your wife in hospital, rather than something, you know, because you have to go, otherwise you're going to feel something's going to happen, right? Then that's where it's more about the way they think about that thought and that behaviour rather than, you know, does that make sense?
Yeah. Can I ask about, because you related it to culture,
Yeah.
and I think within, and you also previously talked about microcultures and subcultures, and within a family the family can establish their own culture.
Yeah.
What do you do if something, or how common is it that kind of obsessive attitude is shared among the whole family about either eating or exercise or whatever, but this idea of self-image is sort of normalised and therefore not protected?
Yeah, see again, it's like that spectrum I'm talking about. If you're able to function with it, and it's maybe your way of getting through things, like exercise, some people love exercise and if they don't, they get stressed, then it's okay. But when it comes to a point where it is kind of, affecting your functioning, okay? And the other thing with family is, I'll talk about family therapy later, okay? So when you're dealing with someone with a mental health illness and you ask them about, can I open another window? I'm just like really hot. That's really, thank you. Right. So, so family therapy is when we talk about people with mental health problems, we then, and when they say, actually, this is what my family believes, okay, or this is what I've been brought up, then you might think, actually, family therapy, going in and talking to that family might be a good idea, okay. So family therapy is when a practitioner, or a counsellor or psychologist goes in and talks to either family as a group or family individually, okay, to try and kind of make them understand or see things differently or question their assumptions, you know. So that's kind of thing that we suggest for that.
At what point do you diagnose it and say, okay, this isn't just a family who have managed to find a way of operating with this is actually an illness?
When it affects your functioning, then you can't function properly. Because it's hard, you're not on that spectrum, right? If you're doing fine and you're excelling at everything, how can it be a problem? Like hearing voices, but you're doing great, how can it be a problem?
It just sounds like maybe that leads to detecting something later when it could have been tackled earlier.
Yeah, but how would that person present? Where would they? Because they would never go to someone and say that's a problem because they think it's normal.
Yeah, exactly.
Yeah, so maybe you could, I suppose. I mean, this is something that in my group where when I want you guys to talk about what we can do as a community. It's okay, but how would you kind of what can you do? Do you just kind of increase people's knowledge about things? Get them to understand that actually it can lead to. Because you're right, it might be obsessive behaviour that might lead to something. Like I'm sure if I get a mental illness, then it would be around obsession because I'm always checking them just because I'm thorough. Okay? I came in with my little kind of timetable and showed her, and she goes, "Oh, that's really organised." And I was like, "Yeah, because I need to know where everything is." But it's being organised. I'm a little bit, not anal, but I'm a bit particular about getting things done. Okay. So again, as long as you're a highly functioning individual, then no one worries about you. Famous people, whatever, mathematicians, Nobel Peace Prize winners, whatever. The people don't. It's not a problem. It's only when it gets to the point where it's affecting you to the point where you can't function. Yeah.
the only reason I ask is, well, for lots of reasons, but also when children are involved, and so a mother or father might be highly functioning, but actually it's affecting their kids, and
Yeah, then that's different, because then it might, because this is the other thing. Like with if I just take my family, right? You know, some children you need to push, like you have to be really strict on the hard and that works for them. But other will make that child be really kind of stressed out, worried, anxious all the time. You know, so different things work for different individuals again, right? So how for one individual that type of upbringing might be perfect, might help them. For another individual it might not, and that's the kind of thing that as kind of parents, our society, we need to kind of acknowledge that actually everyone's different, and some people it works for them, and that's fine, but some people it doesn't. And to impose your values, I mean, good values are fine, but even then, you know, a level judge you once you're old enough on your own decisions, and it's not, you know, you can't be accountable for someone else's decisions. So, you know, you should treat them as individuals. Yeah. Anything else?
Yeah, just like a comment on the exercise.
Yeah.
That the most famous person probably that was actually died of over-exercise was Bruce Lee. He obsessed about his body and his body image and worked out to build his muscle. And he was obsessed about reducing his body fat. And he reduced his body fat to such an extent that that was the cause of his death. So he over-exercised
There you
to
go.
that extent.
Yeah. Yeah. But I suppose people who are kind of, because he's on the extreme of the spectrum, right? He's a kind of famous person who's excelled in his field. So those, when you're on the extremes, that's when it's actually, it's worrying. When you're in the middle, it's kind of okay.
Isn't that part of the worry when you talk about functioning? For everyone else, he was doing very
really
successful,
hard,
doing
yeah.
all these brilliant movies, excelling, and everyone was applauding him, and he felt, I need to do more and more, to the extent that
So
he
where-
reduced his body fat.
But again, where did it come from? Was it there already? Or was it the pressure that society put on, or he felt society was putting on him, right? Okay, and it's hard, you're right, when people are doing alright, you can't be kept at right? And that's the problem with mental health, you know, that actually you might not recognise there is a problem, but it's too late. You know, it's not easy. I mean, you know, everyone thinks medicine is like you come in, you just tell me a few things and I'm like going to cure you. No, it's not, you know, it's like you have to, it's complicated, it's, you know, yeah, majority of things we're okay with it, but there's some things that are really hard that we either don't know enough about, or we need to do more research, or are new things that we don't even know exist yet, okay? You know, so when you get labelled with a syndrome, it's like normally they don't know what it is, and that's why I call it a syndrome, till someone proves what, you know, researches and finds out what it is. You know? So it is difficult, yeah, you're right. Anything else?
Could you make an argument that in a sort of society where we have this attitude that it's like the survival of the fittest, you know,
Yeah.
we have this like capitalist or
Yeah.
free market type
Yeah.
situation. So basically, to be the fittest, you have to kind of be mentally disordered. Like you have
Yeah.
to have, because you have to be even very obsessed
Yeah.
and have some of these
Yeah.
problems. And so it kind of shifts the general population towards that direction
Yeah.
because they're chasing.
Yeah, I mean, I often say that in this country, we're kind of, you know, our stress levels and happiness levels are lower in developing countries when they do this poll every year or whatever. So why are we, when we have no food worries, no living worries, no, you know, yeah, we have worries, but not as many as people in developing countries, yet why are we unhappy, right? It's because we're kind of like pushed to work too hard in this country, pushed to kind of excel, you get a bigger car, bigger house, bigger everything, right? To the point of where we're just kind of making ourselves sick, you know? And, you know, and that's half the people who come in, you know, which I'll talk about later, is the fact that they're just doing too much. If you're trying to fit in 30 hours of work in a 24-hour day, you're going to get stressed, you're going to burn out, you're going to be tired, you're going to get ill, right? Whether it's a physical illness or mental illness. You know, your body can take so much, right? So yeah, I do agree with you that the society kind of pressure on us to always, you know, why, like if you're working like law, banking or in the city or whatever, you know, even medicine sometimes, why do you have to work 14, 16 hours a day? What's the point in that? You know? And to me, it's how the elite control the masses by either making them poor, by religion, or making them work so hard that, you know, so that they don't have time to think. And by poor, I mean middle class as well. The elite. Is the last one? Yeah. Okay, so the last one before we have a little break is bipolar disorder, which is also formerly known as manic depression. And the kind of, what this is in the name, manic depression or bipolar, the two extremes. So you have extreme swings in mood. You can have mania, episodes of mania, where you're overactive, excited, euphoric, okay, to the point where you like, yeah, I'm gonna go and buy that massive new car that, you know, but even though you can't afford it because you're so related, and then when you come down from your mania, you realise you can't afford that, okay. So people in manic episodes do things over and above what they can actually do, or buy things, or, you know, put themselves down for, you know, kind of things that they would normally do when they were thinking normally, okay. And then the other side is depression, and then we talked about depression being low, hopeless, worthless, okay, you know, tired, that sort of thing. And then with bipolar patients, they also get the hallucination, which is hearing or seeing things that other people can't hear or see, or believing in things that other people don't believe, okay, that are not normal for their context. Okay, so anybody want to ask about bipolar?
I have another question, it's not related to that. It's about childhood anxiety.
Yeah.
So if you have a patient that's say 8 years old pulling eyebrows out, then what is the goal of treatment? Is it to determine the origin? For example, if it's the parents, then what would be the goal of therapy?
Yeah, with children, they are more hard to treat. So in GP land, we would only treat really depression and anxiety in adults. Okay. Anything else, the other things we talk about, schizophrenia, OCD, bipolar, eating disorders, children, go to specialists. Okay. And with children, you have the CAMS team, which is Child Adolescent Mental Health Service. Okay. And they would then, normally the children have to do family therapy because they are dependent on their parents, right? So you have to, you know, find out what's going on at home. That might be a sign of distress at home. Parents are breaking up. You know, maybe there's abuse going on. Maybe there's a little child being born and that's going on. You know, like sometimes when there's a child that's ill, they get all the attention. So the child that's well is neglected. Okay? So there's definitely something going on that someone doesn't know about or hasn't.
So the treatment is aimed at correcting maybe the behaviors of the parents?
Yeah, so it's kind of finding out why, okay, and then trying to kind of reverse that, okay. And medication in children is a little bit more tricky because with all the studies, pharmaceutical companies only do tests and trials, only pay for tests and trials on, well, adults, okay, because they don't want to chance it with a child or a pregnant lady. So when it comes to kind of data on that, and it's actually unethical that an adult can consent and say, okay, I'm going through this trial, and, you know, but a child can't consent under the age of, you know, 16 or whatever, okay? So therefore there's no kind of trials or data on what if these drugs work in children. So it's really hard. And normally with that, it's kind of down to kind of drugs that have been around for ages, and in the older days when it was completely ethical to try drugs on children. Okay? So that a lot of our data is from them, and that's why we know that it doesn't work. So you would use drugs in children, but probably less.